Continue the conversation with Dr. Ramesh Adalja. He's a senior scholar at Johns Hopkins Center for Health Security. Dr. Adalja, it's good to see you. Just when you look at what has happened over the past week plus, 4 of the worst 5 days of this pandemic in terms of new infections at a daily rate in the last week, when you're projecting out, what worries you most?
What worries me most is those hospitals that we're hearing about that are worried about capacity, that are worried about ICU beds, that are thinking about how they're going to continue their other operations. That's what flattening the curve is about. It's trying to preserve hospital capacity. And hearing about El Paso and Utah, the Dakotas, as well as Wisconsin, getting in trouble again, the way that New York did in March. That's what we were trying to avoid, and we were unable to avoid it. And I think it really has to do with the fact that this virus has never been controlled. We don't have a testing strategy, and we don't have the public infrastructure to deal with this.
And so Dr. Anthony Fauci now says he would prefer a national mask mandate, but listen here, he's skeptical it would ever happen.
We lean on you for advice. Do we need a national mandate or not?
Yes. Well, we do. If we don't get one, then I would hope that the governors and the mayors do it locally if it's not done nationally. Well, I haven't spoken to the president in quite a while about the situation with regard to the outbreak. Obviously, we have had a disparate response. I have been saying that, Shep, for months now.
Interesting there on several fronts, including it would be nice to have a national mask mandate, but we won't have one, so the governor should do it. But then again, look at what's happening in the case count, the infections, the hospitalizations, and the top infectious disease expert in the United States of America on the government payroll says I haven't spoken to the president in quite some time.
Yeah, this is just very, very concerning because Dr. Fauci is the voice of reason here. He is somebody whose hand has guided this response, and whatever good has happened has largely been his and other infectious disease. It's been their influence. And when his influence wanes, we all suffer. And when it comes to masks, I think that the data that didn't quite exist at the beginning of the pandemic is really now becoming almost incontrovertible, that face coverings do help decrease the force of infection. And we need to get people to start thinking about this as the best and easiest common sense measure to reduce the harm from this virus. But there is still mixed messaging going on. There are rallies occurring all over the country where people are not wearing masks, and we know that this is leading to cases. And if we're going to get through this winter, we need people to just follow this very simple advice and wear a face covering when they can't social distance. It will go a long way towards keeping our hospitals out of trouble.
Not only are people crowded at rallies, they're hearing things at rallies that I think, number one, don't comport with the science, and number two, don't sound very responsible, including this.
A friend of mine, a great senator, somebody that has extraordinary common sense. That's one of the reasons he's a successful man at what he does. Senator Rand Paul.
Thank you. Here's to immunity.
To immune people.
Here's to immunity, to immune people from the President of the United States. Obviously had his COVID episode, Senator Paul. Is that factual, or is that the way you should be talking about this if you're in a position of leadership?
No, it's absolutely the wrong way. We cannot pursue anything looking like a herd immunity strategy without killing hundreds of thousands of people. And I think that Dr. Paul needs to be held to a higher standard. He is a physician. He is a medical doctor. He knows better than that. And to pander to this kind of nonsensical unreality that some people live in really just baffles the mind, and it has made it so much harder for those of us in the field to try and actually give people proper protective action guidance when they're hearing the exact opposite from the president and from a physician who serves in the Senate.
Dr. Adalja, grateful as always for your time and your insights, sir. Very much appreciate your time.
Thank you.